Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuy.com. This is 30 Practice NCLEX questions. Without delay, let's get started.
What should the nurse assess prior to administering digoxin? 1. Sclera. 2. Apical pulse rate. 3. Cough. 4. Liver function test. The correct answer is 2. Apical pulse rate. The apical pulse rate is assessed because digoxin decreases the heart rate. If the heart rate is less than 60 beats per minute, digoxin should not be administered. The sclera has nothing to do with congestive heart failure. Cough would not be assessed before administration. It is more commonly seen in patients who have been prescribed ACE inhibitors. Liver function tests are not assessed before digoxin is administered. Digoxin can lower the heart rate and cause dysrhythmias.
The client is receiving 6 milligrams of selegiline transdermal system every 24 hours for major depression. The nurse should judge teaching about selegiline to be effective when the client makes which statement? 1. I need to avoid using the sauna at the gym. 2. I can cut the patch and use a smaller piece. 3. I need to wait until the next day to put on a new patch if it falls off. 4. I might gain at least 10 pounds from the medication. The correct answer is 1. I need to avoid using the sauna at the gym. Rationale. Selegiline transdermal system is the first transdermal monoamine oxidase inhibitor. The client needs to avoid exposing the application site to external sources of direct heat, such as saunas, heating lamps, electric blankets, heating pads, heated waterbeds, and prolonged direct sunlight, because heat increases the amount of selegiline that is absorbed, resulting in elevated serum levels of selegiline. Cutting the patch and using a smaller piece will result in a decreased amount of medication absorption, most likely leading to a worsening of the symptoms of depression. The client should apply a new patch as soon as possible if one falls off to ensure an adequate amount of medication absorption. Selegiline is not associated with significant weight gain, although a weight gain of 1 to 2 pounds is possible.
Several patients have just come into the obstetric triage unit. Which patient should the nurse assess first? 1. A 17-year-old gravida 1, para-0 woman at 40 weeks gestation with contractions every 6 minutes who is crying loudly and is surrounded by anxious family members. 2. A 22-year-old G3P2 woman at 38 weeks gestation with contractions every 3 minutes who is requesting to go to the bathroom to have a bowel movement. 3. A 32-year-old G4P3 woman at 27 weeks gestation who noted vaginal bleeding today after intercourse. 4. A 27-year-old G2P1 woman at 37 weeks gestation who experienced spontaneous rupture of membranes 30 minutes ago but feels no contractions. The correct answer is 2. A 22-year-old G3P2 woman at 38 weeks gestation with contractions every 3 minutes who is requesting to go to the bathroom to have a bowel movement. A multiparous patient in active labor with an urge to have a bowel movement will probably give birth imminently. She needs to be the first assessed. The healthcare provider must be notified immediately, and the patient must be moved to a safe location for the birth. She should not be allowed to go to the bathroom at this time. The other patients all have needs requiring prompt assessment, but the imminent birth takes priority. Vaginal bleeding after intercourse could be caused by cervical irritation or a vaginal infection, or could have a more serious cause such as placenta previa. A client with chest pain is prescribed intravenous nitroglycerin. Which assessment is of greatest concern for the nurse initiating the nitroglycerin drip? 1. Serum potassium is 3.5 milliequivalents per liter. 2. Blood pressure is 88/46. 3. ST elevation is present on the electrocardiogram. 4. Heart rate is 61 beats per minute. The correct answer is 2. Blood pressure is 88/46. Nitroglycerin is a vasodilator that will lower blood pressure. The client is having chest pain, and the ST elevation indicates injury to the myocardium, which may benefit from nitroglycerin. The potassium and heart rate are within normal range. The nurse is completing a health assessment of a 42-year-old female with suspected Graves' disease. The nurse should assess this client for 1. Anorexia, 2. Tachycardia. 3. Weight gain. 4. Cold skin. The correct answer is 2. Tachycardia. Graves' disease, the most common type of thyrotoxicosis, is a state of hypermetabolism. The increased metabolic rate generates heat and produces tachycardia and fine muscle tremors. Anorexia is associated with hypothyroidism. Loss of weight, despite a good appetite and adequate caloric intake, is a common feature of hyperthyroidism. Cold skin is associated with hypothyroidism. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A nurse manager is informed that a large number of clients will be admitted in response to a terrorist attack. Which type of leadership style is appropriate to use in this situation? 1. Collaborative. 2. Authoritarian. 3. Laissez-faire. 4. Democratic. The correct answer is 2. Authoritarian. Rationale. The authoritarian leadership style is the appropriate style to use in a crisis when urgent decisions are necessary. In a crisis, one person must assume the responsibility for decisions. Autocratic leaders give orders and directions and make decisions for the group. Collaborative is not a classic leadership style. Collaborative refers to the democratic leadership style. Democratic leaders encourage discussion and decision-making within the group, which requires collaboration, coordination, and communication among group members. The laissez-faire leadership style is not the appropriate style to use in a crisis when urgent decisions are necessary. Laissez-faire leaders are non-directive and permissive, which allows for self-regulation, creativity, and autonomy but limits fast-acting efficiency. The democratic leadership style is not the appropriate style to use in a crisis when urgent decisions are necessary. Democratic leaders encourage discussion and decision-making within the group, which takes time. A nursing team leader delegates a wound irrigation to a licensed practical nurse. It has been a long time since the LPN performed this procedure. Which should the nursing team leader do to ensure client safety? 1. Verbally describe how to perform the procedure to the LPN. 2. Have the LPN demonstrate how to perform the procedure. 3. Assign another LPN to assist with the procedure. 4. Delegate the procedure to another LPN. The correct answer is 2. Have the LPN demonstrate how to perform the procedure. Rationale. Demonstration is the safest way to assess whether a person has the knowledge and skill to perform a procedure safely. A superior delegating care is responsible for ensuring that the person implementing the care is legally qualified and competent. Providing just a verbal description is unsafe. This does not ensure that cognitive information can be converted to a psychomotor skill. A peer should not be held responsible for the care assigned to another team member. The nurse who delegates a procedure to a subordinate is directly responsible for ensuring that the care is safely delivered to clients. Option 4 does not address the original licensed practical nurses need to know how to perform the procedure safely. This procedure is within the legal scope of practice of a licensed practical nurse, which is the most important reason why a nursing assistant must fully understand how to implement a delegated procedure. 1. Be capable of completing the procedure safely. 2. Be proficient enough to perform the procedure quickly. 3. Have the knowledge to explain the procedure to a client. 4. Have the correct information when teaching the procedure to another nursing assistant. The correct answer is 1. Be capable of completing the procedure safely. Rationale. Safety of the client is the priority. The nursing assistant must perform only the skills that are within the legal role of the nursing assistant and perform correctly on a return demonstration. Nurse aides are trained and supervised by the nurse, not other nurse aides. When delegating a specific procedure to a client care aide, the aide refuses to perform the procedure. Which should the nurse do first? 1. Assign the procedure to another client care aide. 2. Explain that it is part of the client care aide's job description. 3. Explore why the client care aide refused to perform the procedure. 4. Send the client care aide to the procedure manual to review the procedure. The correct answer is 3. Explore why the client care aide refused to perform the procedure. Rationale. The nurse must first explore the reason for the nurse aide's refusal to perform the procedure. The employee may have an acceptable reason for refusing to comply. When the reason is identified, then the nurse manager can take an informed action. Assigning the procedure to another staff member is premature. Another option has priority. The employee may be fully aware of the requirements of the job description and not need to have them described. Even though a task is within one's job description, a person can refuse to perform a procedure because of a reason that is considered acceptable. A first-year nursing student in the clinical area is given an appropriate client assignment by the instructor. Which should the student nurse do? 1. Complete the care indicated on the client's plan of care. 2. Accept the role of leader of the client's healthcare team. 3. Assume accountability for the tasks that are assigned by the instructor. 4. Help other students to complete their assigned tasks whenever necessary. The correct answer is 3. Assume accountability for the tasks that are assigned by the instructor. Rationale. Students are accountable for the tasks assigned by the instructor or preceptor. As part of accountability, students are obligated to keep the instructor or preceptor informed about the status of the client, how the assignment is progressing, and whether all interventions are implemented as planned. Although students are expected to complete all planned care, the client's condition can change or some unforeseen event may interfere with the plan. The student must keep the instructor or preceptor informed about the client's condition and use the instructor or preceptor as a resource person when the unexpected occurs or guidance is needed. Students are assigned to care for clients for a specific time period and generally are included as members, not leaders of the nursing team, particularly beginning nursing students. Students should not help other students unless specifically assigned to do so by the instructor or preceptor. An exception occurs when assistance is needed to ensure client safety in an emergency. Which should the nurse do to ensure efficiency when managing a daily assignment? 1. Give care to a client in isolation first. 2. Plan activities to promote nursing convenience. 3. Organize care around legally required activities. 4. Perform routine bed baths between breakfast and lunch. The correct answer is 3. Organize care around legally required activities. Rationale. Legally required activities must be accomplished because they are dependent functions that support the medical regimen of care. Although legally required activities should be accomplished first, many independent actions by the nurse also must be implemented to maintain a basic standard of care and client safety. Some nursing interventions, which are not essential, can be implemented after the required activities. Client needs are the priority, not the convenience of the nurse. Options 1 and 4 may not be possible, depending on the needs of clients.
A 25-year-old Gravida 2, Para 1 patient has come to the obstetric triage room at 32 weeks gestation, reporting painless vaginal bleeding. The nurse is providing orientation for a new nurse on the unit. Which statement by the new nurse to the patient would require the nurse to promptly intervene? 1. I'm going to check your vital signs. 2. I'm going to apply a fetal monitor to check the baby's heart rate and to see if you are having contractions. 3. I'm going to perform a vaginal examination to see if your cervix is dilated. 4. I'm going to feel your abdomen to check the position of the baby. The correct answer is 3. I'm going to perform a vaginal examination to see if your cervix is dilated. Painless vaginal bleeding can be a symptom of placenta previa. A digital vaginal examination is contraindicated until ultrasonography can be performed to rule out placenta previa. If a digital examination is performed when placenta previa is present, it can cause increased bleeding. The other statements reflect appropriate assessment of an incoming patient with vaginal bleeding.
Which should the manager do first to overcome resistance to change? 1. Ensure that the planned change is within the current beliefs and values of the group. 2. Provide incentives to encourage commitment of participants to the change. 3. Implement change by employing small steps rather than large steps. 4. Use influence power to ensure that goals of change are met. The correct answer is 1. Ensure that the plan change is within the current beliefs and values of the group. Rationale. Change that is consistent with current values and beliefs is easier to implement than change that is inconsistent with current values and beliefs. Values and beliefs are difficult to change. Option 2 is not the priority intervention. Although incentives might motivate some individuals, they do not motivate all because some people have an internal rather than an external locus of control. In option 3, although small steps are more effective than large steps because they are easier to achieve and once achieved, are motivating, this approach is not the first thing the nurse should do to overcome resistance to change. In option 4, although one person sharing explanations with another is helpful when trying to change behavior, it is not the most effective type of power to use when trying to affect change. A nurse manager considers that there are the rights of delegation, which is a right of delegation in addition to right task, right person, right communication, and right time. 1. Place. 2. Route. 3. Feedback. 4. Supervision. The correct answer is for supervision. Rationale. The one who delegates a task is responsible for ensuring that the task is performed safely and according to standards of practice. The right place is not one of the rights of delegation. The right route refers to the rights of medication administration, not the rights of delegation. Feedback is part of communication, which is one of the rights of delegation already cited in the stem of the question. The primary health care provider prescribes fluoxetine orally every morning for a 72-year-old client with depression. Which transient adverse effect of this drug requires immediate action by the nurse? 1. Nausea. 2. Dizziness. 3. Sedation. 4. Dry mouth. The correct answer is 2. Dizziness. Rationale. The presence of dizziness could indicate orthostatic hypotension, which may cause injury to the client from falling. Nausea, sedation, and dry mouth do not require immediate intervention by the nurse.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client is receiving paroxetine 20 milligrams every morning. After taking the first 3 doses, the client tells the nurse that the medication upsets the stomach. Which of the following instructions should the nurse give to the client? 1. Take the medication an hour before breakfast. 2. Take the medication with some food. 3. Take the medication at bedtime. 4. Take the medication with 4 ounces of orange juice. The correct answer is 2. Take the medication with some food. Rationale. Nausea and gastrointestinal upset is a common, but usually temporary, side effect of paroxetine. Therefore, the nurse would instruct the client to take the medication with food to minimize nausea and stomach upset. Other more common side effects are dry mouth, constipation, headache, dizziness, sweating, loss of appetite. Taking the medication an hour before breakfast would most likely lead to further gastrointestinal upset. Taking the medication at bedtime is not recommended because paroxetine can cause nervousness and interfere with sleep. Because orange juice is acidic, taking the medication with it, especially on an empty stomach, may lead to nausea or increase the client's gastrointestinal upset. After a few minutes of conversation, a female client who is depressed wearily asks the nurse, "Why pick me to talk to? Go talk to someone else." Which of the following replies by the nurse is best? 1. I'm assigned to care for you today if you'll let me. 2. You have a lot of potential and I'd like to help you. 3. I'll talk to someone else later. 4. I'm interested in you and want to help you. The correct answer is 4. I'm interested in you and want to help you. Rationale. The nurse tells the client that the nurse is interested in her to increase the client's sense of importance, worth, and self-esteem. Also, stating that the nurse wants to help conveys to the client that she is worthwhile and important. Telling the client that the nurse is assigned to care for her is impersonal and implies that the client is being uncooperative. Telling the client that the nurse is there because the client has potential for improvement will not help the client with low self-esteem because most people develop a sense of self-worth through accomplishment. Simply saying that the client has a lot of potential will not convince her that she is worthwhile. Telling the client that the nurse will talk to someone else later is not client-focused and does not address the client's question or concern.
A 26-year-old Gravida 1, Para 1 patient who underwent a cesarean section 24 hours ago tells the nurse that she is having some trouble breastfeeding. Which tasks could be appropriately delegated to the assistive personnel on the postpartum floor? Select all that apply. 1. Providing the mother with an ordered abdominal binder. 2. Assisting the mother with breastfeeding. 3. Taking the mother's vital signs. 4. Checking the amount of lochia present. 5. Assisting the mother with ambulation. 6. Checking the incision site. The correct answers are 1. Providing the mother with an ordered abdominal binder. 3. Taking the mother's vital signs. And 5. Assisting the mother with ambulation. The AP could provide an abdominal binder, measure the vital signs of the patient, and assist her to ambulate. The nurse would be responsible for evaluating the normality of the vital sign values. The AP should be given parameter limits for vital signs and told to report values outside these limits to the nurse. Assisting in breastfeeding for a first-time mother is a very important nursing function because the nurse needs to give consistent, evidence-based advice to enhance success at breastfeeding. A common complaint of postpartum patients is inconsistent help with and advice on breastfeeding. The nurse should also be the one to check the amount of lochia and the surgical incision site because the evaluation requires nursing judgment. The use of the professionally educated nurse to provide evidence-based and consistent information and assistance with breastfeeding supports the perinatal core measure of increasing the percentage of newborns who are fed breast milk only. An older adult had a myocardial infarction 4 days ago. At 9:30 a.m., the client's blood pressure is 102/64. After reviewing the client's progress notes, see the chart on PDF download, the nurse should first 1. Give a fluid challenge/bolus. 2. Notify the healthcare provider. 3. Assist the client to walk. 4. Administer Lasix as prescribed. The correct answer is 2. Notify the healthcare provider. All of the 12 p.m. assessments are signs of decreased cardiac output and can be an ominous sign in a client who has recently experienced an MI. The nurse should notify the healthcare provider of these changes. Cardiac output and blood pressure may continue to fall to dangerous levels, which can induce further coronary ischemia and extension of the infarct. While the client is currently hypotensive, giving a fluid challenge bolus can precipitate increased workload on a damaged heart and extend the myocardial infarction. Exercise or walking for this client will increase both the heart rate and stroke volume, both of which will increase cardiac output, but the increased cardiac output will increase oxygen needs, especially in the heart muscle, and can induce further coronary ischemia and extension of the infarct. The client is hypotensive. Although the client has decreased urinary output, this is the body's response to a decreasing cardiac output, and it is not appropriate to administer Lasix. A client with a large goiter is scheduled for a subtotal thyroidectomy to treat thyrotoxicosis. Saturated solution of potassium iodide is prescribed preoperatively for the client. The expected outcome of using this drug is that it helps 1. Slow progression of exophthalmos. 2. Reduce the vascularity of the thyroid gland. 3. Decrease the body's ability to store thyroxine. 4. Increase the body's ability to excrete thyroxine. The correct answer is 2. Reduce the vascularity of the thyroid gland. SSKI is frequently administered before a thyroidectomy because it helps decrease the vascularity of the thyroid gland. A highly vascular thyroid gland is very friable, a condition that presents a hazard during surgery. Preparation of the client for surgery includes depleting the gland of thyroid hormone and decreasing vascularity. SSKI does not decrease the progression of exophthalmos, and it does not decrease the body's ability to store thyroxine or increase the body's ability to excrete thyroxine. Before we move on to the next question, The NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
An 85-year-old client is admitted to the emergency department at 8 p.m. with syncope, shortness of breath, and reported palpitations. Pulse is 150, blood pressure is 90/62, oxygen saturation is 92% on room air, and respiration is 22. Client has shortness of breath and states, "My heart is jumping out my chest, and it hurts some. I am having trouble catching my breath. I don't want to faint again." At 8:15 p.m., the nurse places a client on the ECG monitor and identifies the following rhythm. See the picture below. The nurse should do which of the following? Select all that apply. 1. Apply oxygen. 2. Prepare to defibrillate the client. 3. Monitor vital signs. 4. Have the client sign consent for cardioversion as prescribed. 5. Teach the client about warfarin, Coumadin, treatment, and the need for frequent blood testing. 6. Draw blood for a CBC count and thyroid function study. The correct answers are 1, 3, and 4. The client has atrial fibrillation and will have a regular pulse and will commonly be tachycardic, with rapid ventricular responses typically in the 110 to 140 range, but rarely over 150 to 170. The goal of treatment is the restoration of sinus rhythm. With a heart rate greater than 150 and symptoms such as shortness of breath, dizziness and syncope and chest pain, synchronized cardioversion will most likely be the treatment of choice. With more controlled heart rates and more minor signs and symptoms, chemical conversion with drugs such as cardizem and digoxin, prior to other interventions, such as synchronized cardioversion with appropriate anticoagulation, may be attempted. Because of the decreased cardiac output, monitoring is essential. Obtaining consent for cardioversion requires a prescription from a healthcare provider. But with the current heart rate, having cardioversion is a very strong possibility for this client. Defibrillation is used for ventricular fibrillation, not atrial fibrillation. Teaching the client about warfarin will be a possibility, but not an immediate intervention. Clients in continued atrial fibrillation usually require some form of anticoagulation. Drawing labs for CBCs to detect anemia or infection and thyroid function studies to determine thyrotoxicosis, a rare but not to be missed cause, especially in older adults. Serum electrolytes in blood, urea, nitrogen/creatinine, looking for electrolyte disturbances or renal failure, are commonly drawn for determining the cause of the atrial fibrillation, but they are not an immediate action. When developing a teaching plan for the mother of an asthmatic child concerning measures to reduce allergic triggers, which of the following suggestions should the nurse include? 1. Keep the humidity in the home between 50% and 60%. 2. Have the child sleep in the bottom bunk bed. 3. Use a scented room deodorizer to keep the room fresh. 4. Vacuum the carpet once or twice a week. The correct answer is 1. To help reduce allergic triggers in the home, the nurse should recommend that the humidity level be kept between 50% and 60%. Doing so keeps the air moist and comfortable for breathing. When air is dry, the risk for respiratory infections increases. Too high a level of humidity increases the risk for mold growth. Typically, the child with asthma should sleep in the top bunk bed to minimize the risk of exposure to dust mites. The risk of exposure to dust mites increases when the child sleeps in the bottom bunk bed because dust mites fall from the top bed, settling in the bottom bed. Scented sprays should be avoided because they may trigger an asthmatic episode. Ideally, carpeting should be avoided in the home if the child has asthma. However, if it is present, carpeting in the child's room should be vacuumed often, possibly daily, to remove dust mites and dust particles. A client has entered a smoking cessation program to quit a 2-pack-a-day cigarette habit. The client has not smoked a cigarette for 3 weeks and tells the nurse about fears of starting smoking again because of current job pressures. What would be the most appropriate reply for the nurse to make in response to the client's comments? 1. Don't worry about it. Everybody has difficulty quitting smoking, and you should expect to as well. 2. If you increase your self-control, I am sure you'll be able to avoid smoking. 3. Try taking a couple days of vacation to relieve the stress of your job. 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. The correct answer is 4. It is important for individuals who are engaged in smoking cessation efforts to feel comfortable with sharing their fears of failure with others and seeking support. Although fewer than 5% of smokers successfully quit on their first attempt, it is not helpful to tell a client to anticipate failure. Telling the client to exercise more self-control does not provide support. Taking a vacation to avoid job pressures does not address the issue of how to manage the desire to smoke when in a stressful situation.
A client's stools are light gray in color. The nurse should assess the client further for which of the following? Select all that apply. 1. Intolerance to fatty foods. 2. Fever. 3. Jaundice. 4. Respiratory distress. 5. Pain at McBurney's point. 6. Peptic ulcer disease. The correct answers: 1. Intolerance to fatty foods. 2. Fever. And 3. Jaundice. Bile is created in the liver, stored in the gallbladder, and released into the duodenum, giving stool its brown color. A bile duct obstruction can cause pale-colored stools. Other symptoms associated with cholelithiasis are right upper quadrant tenderness, fever from inflammation or infection, jaundice from elevated serum bilirubin levels, and nausea or right upper quadrant pain after a fatty meal. Pain at McBurney's point lies between the umbilicus and right iliac crest and is associated with appendicitis. A bleeding ulcer produces black, tarry stools. Respiratory distress is not a symptom of cholelithiasis. The nurse and an unlicensed assistive personnel are caring for a client with right-sided paralysis. Which action by the UAP requires the nurse to intervene? 1. The assistant places a gait belt around the client's waist prior to ambulating. 2. The assistant places the client on the back with the client's head to the side. 3. The assistant places a hand under the client's right axilla to move up in bed. 4. The assistant praises the client for attempting to perform ADLs independently. The correct answer is 3. The assistant places a hand under the client's right axilla to move up in bed. This action is inappropriate and would require intervention by the nurse because pulling on a flaccid shoulder joint could cause shoulder dislocation. The client should be pulled up by placing the arm underneath the back or using a lift sheet. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with end-stage renal disease is taking calcitriol. Which assessment data warrants intervention by the nurse? 1. The client reports nausea. 2. The client has had 2 episodes of diarrhea. 3. The client has an increase in the serum creatinine level. 4. The client has blood in the urine. The correct answer is 4. The client has blood in the urine. Hematuria is an adverse effect of calcitriol, a vitamin D analog, and the nurse should notify the HCP. This would warrant taking the client off the medication. Nausea is a side effect of calcitriol and can also result from ESRD itself. Diarrhea is an expected side effect of the medication. Therefore, it would not warrant intervention from the nurse. The client in ESRD would have an increased serum creatinine level. Therefore, this would not warrant immediate intervention by the nurse. A 10-year-old child is recovering from a severe sore throat. The parent states that the child complains of chest pain. The nurse observes that the child has swollen joints, nodules on the fingers, and a rash on the chest. The likely cause is blank. The correct answer is rheumatic fever. To make the diagnosis of rheumatic fever, major and minor criteria are used. Major criteria include carditis, subcutaneous nodules, erythema marginatum, chorea, and arthritis. Minor criteria include fever and previous history of rheumatic fever. Rheumatic fever is an inflammatory disease caused by group A beta hemolytic streptococcus.
A client is scheduled for the first electroconvulsive therapy treatment in the morning. The client has been unable to sleep, but at 10 p.m. refused to take Restoral, as the nurse suggested. The client is still unable to sleep at 11:15 p.m. In what order should the nurse do the following? 1. Sit quietly with the client. 2. Encourage the use of Restoral. 3. Offer use of MP3 player with relaxing music. 4. Discuss specific concerns. The correct order is 1. Sit quietly with the client. 4. Discuss specific concerns. 3. Offer use of MP3 player with relaxing music. And 2. Encourage the use of Restoral. Rationale. The client is likely anxious about the procedure. The nurse should first spend time with the client and then discuss the client's concerns about the procedure. Next, the nurse could suggest the client listen to relaxing music. The use of the sleeping medication would only be considered as a last resort since it might interfere with the effectiveness of the seizure required for the treatment.
A 30-year-old woman with type 1 diabetes mellitus comes to the clinic for preconception care. Which information would be the priority to communicate to her at this time? 1. Her insulin requirements will likely increase during the second and third trimesters of pregnancy. 2. Infants of mothers with diabetes can be macrosomic, which can result in a more difficult delivery and a higher likelihood of cesarean section. 3. Breastfeeding is highly recommended, and insulin use is not a contraindication. 4. Achievement of optimal glycemic control at this time is of utmost importance in preventing congenital anomalies. The correct answer is 4. Achievement of optimal glycemic control at this time is of utmost importance in preventing congenital anomalies. The incidence of congenital anomalies is 3 times higher in the offspring of women with diabetes. Good glycemic control during preconception and early pregnancy significantly reduces this risk and would be the highest priority message to this patient at this point. The other responses are correct, but are not of greatest importance at this time. A client has chest pain rated at 8 on a 10-point visual analog scale. The 12-lead electrocardiogram reveals ST elevation in the inferior leads and troponin levels are elevated. What is the highest priority for nursing management of this client at this time? 1. Monitor daily weights and urine output. 2. Permit unrestricted visitation by family and friends. 3. Provide client education on medications and diet. 4. Reduce pain and myocardial oxygen demand. The correct answer is 4. Reduce pain and myocardial oxygen demand. Nursing management for a client with a myocardial infarction should focus on pain management and decreasing myocardial oxygen demand. Fluid status should be closely monitored. Client education should begin once the client is stable and amenable to teaching. Visitation should be based on client comfort and maintaining a calm environment. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.